Now, there are calls this morning for the UK's sewage network to be urgently upgraded to reduce the risk to health from human waste.
A report by the Royal Academy of Engineering says increased investment and more green spaces in cities would help bring down the likelihood of infections from bacteria and viruses. Our climate and science reporter Esme Stallard has more.
It's one of the joys of summer, being able to cool off in the UK's rivers. But an ageing infrastructure and a growing population is raising the risk of infection from unseen organisms in the water, according to scientists. The impact of contamination can be serious, as residents in Devon found out last week when the parasite Cryptosporidium got into their water supply due to a fault in a valve in South West Water's network. The company apologised and said it was sincerely sorry, but dozens of locals came down with diarrhoea, with some people ending up in hospital. The government has said it is already driving the largest infrastructure programme in water company history, but the authors were keen to stress that billion-pound infrastructure projects like Thames Tideway wouldn't be enough. They said the government needs to look long-term how we design our cities. Instead of paving over our streets, we need more natural landscapes like wetlands, which can absorb the additional rain we can expect from climate change. They also recommended more data must be shared with the public about the quality of our rivers so they can keep themselves safe. Water UK said public health was a major part of their upcoming investment programme. Esme Stallard, BBC News.
Well, let's discuss this further, shall we? We're joined now by Barbara Evans, Professor of Public Health Engineering at the University of Leeds. Good morning to you, Professor. Thanks for joining us. What are the kinds of things that could be done to start with, the initial projects that you think might improve our sewage network?
Yeah, that's a great question. I mean, we all know it's a topical issue, right? And it's really, I just want to say it's really not exciting, but it's really positive that people have, got engaged in this issue, and we're really excited to see people using bathing waters. So we want to think about things we can do in the short term that can make that as safe as possible. Mostly that would focus, we've made 15 recommendations, but the top one is to focus on improved operation and maintenance of the existing assets. Some of the things that are being recommended are new infrastructure and new construction, but I think alongside that we really need to look at running the system we have really as well as we possibly can.
Is that because improving the current system is less expensive than building entire new parts of the network?
Yeah, it's partly that, but it's also because infrastructure needs maintenance and good operation. So if you make the investment, it's worth also investing in that sort of operations and maintenance. It's also worth investing in, and as your reporter mentioned, really good data so we can keep track of how the system's performing in real time. And I think it's really, all of that really needs to be embedded in a more general conversation about what we want this system to do. If I may be allowed to say, I think one of the things that I always want to say about this is that this is an incredible system. It's kept us safe for 170 years, but most of us don't think about it from day to day. It's kind of hidden away. And I think it's really a good opportunity now to just take stock and say, we really value this, and we really need to invest in ensuring that the infrastructure we do build is well operated and well maintained.
If we were designing a system today from scratch, would it be very different from the system we've got now from Victorian times?
Yeah, that's a great question. Not very different, but we definitely have more technological knowledge now. We can definitely see opportunities to innovate for the technologies that we're using. I think the other thing to bear in mind is that although our system was originally put in place as a public health intervention, in the last 40 to 50 years, the focus has really been on improving environmental performance. And that's really important. So we've selected treatment processes, for example, that do that well. But we've perhaps slightly lost sight of that additional public health role that it needs to play. So I would say it's about, probably we would do it slightly differently, but we'd still have a system which takes fecal matter, which is extremely dangerous and nasty, away from where people are, treats it to an appropriate level, and then uses the environment as part of a natural process of reabsorbing that waste, if you like, into the environment.
So you're talking today about what the water companies, what government can do to try to improve the system. I just wonder whether to finish, we should just ask you What can we all do? I mean, there'll be millions of toilets being flushed while we're speaking to one another right now in households across the country. What can individuals do?
Yeah, well, first of all, be very glad, because that toilet's a big luxury. Number one, absolutely top of the list, please do not flush anything unflushable down those toilets. Wet wipes, plastic nappies, anything that isn't what should be in the toilet, please keep it out of the toilet. But I think also that we all have a role to play in trying to reduce the ingress of clean water into the wastewater system. So anything people can do to stop rainwater getting into the system, that means water butts. If you can, re-grass perhaps part of your tarmacked front drive. Anything that can help sort of soak up water at the point where it falls, rather than have it flowing into the drainage network, and quite a lot of that, of course, then into the sewer network.
OK, good advice there. Professor Barbara Evans, thank you very much indeed for joining us.
Thanks very much.